While government officials and lawmakers say billions of COVID-19 relief dollars were lost to fraud, abuse, and some say mismanagement. That was the focus of the House's Oversight Committee's first full hearing. Our Washington, D.C. correspondent Rachel Knapp reports.
We owe it to the American people to get to the bottom of the greatest theft of American taxpayer dollars.
In the first House oversight hearing, members on both sides of the aisle took swipes at each other. Republicans, who are now in the majority, blamed the other side for a lack of oversight on this issue. Democrats argue when they were in the majority, they've had several hearings on fraud and abuse of COVID funding. Once they stopped taking jabs, federal officials say fraudsters took advantage and stole billions from COVID relief payment programs the government created in response to the pandemic.
Criminals were prepared to exploit the pandemic, in part because for years they were selling identities stolen from past data breaches. They were also fabricating identities using personal and financial data of real people combined with false information. Our investigations also reveal that criminals use shell companies and false employment information.
Officials say most of the money that was fraudulently collected could have been saved if there were more screenings as to who and where that money was going to.
How many people do we know received money from the federal government that were on the do not pay list?
I don't know across all programs. What I do know is from the SBA's PPP program, because almost $400 billion went out in 2 weeks in that program. Of that amount, 57,000, 3.6 billion shouldn't have gone out right away. Not saying every one of those would have been denied, but at a minimum, there should have been secondary screening.
Overall, officials say some hard lessons were learned, and they are still working to recuperate the billions of dollars they believe were fraudulently taken from COVID relief programs. At the Capitol, Rachel Knapp reporting.